21st International AIDS Conference taking place here in South Africa. It's over to you, Leanne.
Thank you very, very much, Palesa. Yes, indeed, that's where we are stationed this morning. We're actually outside of the convention center where all the delegates are slowly arriving and not much action at the moment. I can imagine that it's all going to be taking place a little bit later on. But wow, is the security tight around here. So I can tell you, if you've got any ambitions of coming down here, please don't, because you're not going to get anywhere. Trust me, I know. It was a challenge to just get to the broadcast this morning for myself. Unfortunately, not able to get accreditation last night due to the fact that I was on a plane that I was delayed for hours. So I only got into Durban at about 2 o'clock this morning. So it has been a struggle to be here. But I can tell you one thing. I'm grateful to be here because, when we look back as to how far as a country we have come in the treatment and the fight against HIV and AIDS, it is huge. It's been a struggle, but it's been huge. But the road ahead is still quite a long one as well to try and rid South Africa of this huge scourge. But let me tell you a little bit more about the international conference that starts today. Our Deputy President, Cyril Ramaphosa, is going to be officially opening this conference this morning. And he, of course, is the chair of the AIDS panel here in South Africa. So it's only fitting that he is the one that does open it. President Zuma is out of the country right now as well. He's in Rwanda, so he couldn't be a part of this. But the Deputy President holding down the fort there as well. Among some of the dignitaries that are going to be attending, well, we have it that United Nations Secretary General Ban Ki-moon is going to be here. We also hear that Prince Harry, as well as Charlize Theron, is going to be one of the guests, as well as Elton John. So Elton John is also going to be one of the dignitaries, and all of those people that I just mentioned have really been very vocal and have done a lot for creating awareness and, of course, being activists when it comes to leaderships in this cause. So that's people that can be expected to attend here. But it's those people that work every day tirelessly in the healthcare sector that do everything they can to better the lives of those that are struggling with HIV and AIDS. Let's take a look at this insert that focuses in on those wonderful health workers.
The 90s and 2000s, the dark days of HIV in South Africa, hospitals overwhelmed and doctors not coping. Millions died. Fast forward to 2009, the turning point. Government increased the CD4 count threshold for the provision of ARVs from 200 to 350. But due to the shortage of doctors, patients continued dying while on the waiting list. KwaZulu-Natal bearing the brunt. Officials had to think fast and smart. They trained 1,700 nurses in initiating and managing the antiretroviral treatment, NIMAT.
When we started this NIMAT program, you had to get in all clinics a particular nurse trained so that you don't only initiate at Edendale Hospital or at Northdale Hospital, but you'll get all other 40 clinics surrounding that district initiating. Therefore, instead of getting 10 people on a program, which could be that one hospital, you would get in a particular day over 50 patients started on treatment relying on these other clinics. So that is how we were swelling the numbers.
Professional nurse Silindile Kumalo works at Jolivet Clinic in rural Ikopo. She is one of the NIMAT nurses. Across the road from the clinic, a church used holy water and prayer allegedly to cure illnesses, including HIV.
It wasn't easy at all. Remember that you're Africans, you want to believe in our own things. The leaders believe that the water do treat HIV and there's no need to use a treatment, to use ARVs. Then I started by convincing one patient at a time, and one patient will call another. They started taking treatment privately up until we call upon a meeting and we discuss the importance of taking treatment, and the patients were testifying the importance of taking treatment.
A strategy was needed to convince the church to allow patients to test and take treatment.
I had to convince them and made them see the need that ARVs do treat HIV, yet they believe they need to use water, only the holy water. I explained to them that they can use the holy water to swallow the pills that I give to them.
It's now a happy, lasting relationship as Khumalo even delivers treatment to the church.
Initially, we used holy water, but now when people know their HIV status, we bless the tablets as well, and they continue drinking holy water.
About 100 kilometers away in rural Harding is Sister Tembeka Madubela, also a NIMAT nurse. She routinely visits a local traditional healer who used to have hundreds of patients flocking to his place for HIV medicine.
It was a challenge to us because it was like we were taking away his work, but we convinced him that there is no need for him to worry because we are working together.
With a lot of convincing, he not only allowed his patients to test and take ARVs, he himself is on ARV treatment.
ARVs help a great deal. Now, from what I've learned from Sister Madubela at the clinic, I can see if my patient has TB or a sexually transmitted infection, as was the case with myself. Since taking ARVs, I am now well.
Today, all his patients test for HIV before using his traditional medicines.
The clients are going to him for consultation. And then, because he knows firsthand the symptoms and the signs of STI and HIV/AIDS plus TB, he just brings them up to us.
It's been a long and difficult journey for these nurses, but a journey they are willing to travel again should the need arise. To date, there are 3.4 million people on ARV treatment in the country, and 1.1 million are from KwaZulu-Natal. Linda Mkobozi, SABC News, Durban.